This is News 4 San Antonio.
And good afternoon. Our entire team now working to follow a number of developing stories when it comes to the coronavirus pandemic. First, city officials are saying we are getting close now to running out of hospital beds. So what does that mean for you if you or a loved one has a medical emergency right now?
And there are a lot of questions surrounding testing tonight. We are answering all of them for you, like when should you get tested and what should you do after you're tested? And if you are positive for the virus, how do you know when you've recovered? And in 15 minutes, Governor Greg Abbott will be joining us live from Austin to answer a lot of our questions about hospital bed capacity, heading back to school for teachers, and so much more.
Now, we want to start with that hospital capacity number. Right now, 11% of all the hospital beds in San Antonio are still available for you and your family should a medical issue arise. But now, what does that really mean? According to the city's website, there's a total now of more than 4,500 staffed beds in San Antonio, but 89% of them are occupied. I want to break down that 89% of beds as well. More than 1,200 are filled with those COVID-19 patients. That means a little less than 63% of people in the hospital are not there because of the virus. Now, state and city leaders have taken steps already trying to ease the strain on their hospitals and their staff. Elective surgeries have been postponed. More than 800 nurses have been brought into San Antonio hospitals to help staff all those beds that they've set up right now. Also, the Freeman Coliseum Expo halls, they're on standby should they need to be used to hospitalize patients.
But life doesn't just stop because of the coronavirus, of course. So what does this mean? What does the diminished hospital capacity mean for you if you have an emergency and you need to go to the ER? News 4 San Antonio's Zach Hedrick spent the day digging deeper into that situation and what it would look like for you. Zach, what'd you find out?
Well, Delaine, tonight one chief medical officer tells me that his ICU and emergency room are in a tough spot. Overall, area hospital systems say they do have the space to handle medical emergencies as they pop up, but that capability could be in jeopardy.
Our hospital and the medical center is 50% full with COVID patients.
Dr. Ken Davis is the chief medical officer of the Christus Santa Rosa Health System. He says today his ICU beds are full and staff are getting creative to add more.
We're actually moving out of administration and putting hospital beds in the administrative suite.
Davis says doing that creates another problem.
But trying to staff them is quite a challenge.
On top of a surging COVID caseload, area hospital systems are also making sure there is bed space for other emergencies.
Cancer, car crashes, heart attacks, these things don't stop during a pandemic.
It's across the board the same level of pressure.
Eric Epley is the executive director of STRAC and says all hospital systems are able to handle urgent care cases for now.
If we're still filling up, then you start to threaten those kinds of capabilities, and that's what we want to avoid at all costs.
To preserve beds and staff, Epley says right now area hospitals are only performing surgeries and procedures that are considered life-saving.
Any other surgery is being evaluated by a rigorous surgery review process in every single hospital.
Epley and Davis say wearing a mask and continuing to social distance will help ease the burden on hospital bed capacity.
What's in it for you is making sure the hospital is there when you need it, making sure your loved ones have the ability to get care.
Now, Epley tells me he got word today another 200 nurses from state staffing agencies are on their way here to this area. He also says about 40 medical personnel from the Department of Defense, 33 nurses, as well as 6 respiratory specialists began their work in area hospitals today. Back to you.
All right, Zach, thank you. We want to take a closer look at the progression of hospitalizations since the pandemic started here in San Antonio. This is a look at a chart on our website right now. It shows the daily totals since city officials started tracking hospitalizations on April 1st. Now, 72 hospitalizations were reported on that day. We stayed somewhat steady through April and May until June 9th, when we first reported more than 100 cases. From that point on, the hospitalization numbers continued to rise, with almost every 2 days, the numbers reaching another 100 threshold. And then on July 1st, another threshold crossed, more than 1,000 people hospitalized. Yesterday was the first day since we crossed the 100 hospitalizations mark that the numbers actually went down. Tuesday, there were 1,235 COVID-19 patients in the hospital. Yesterday, it dropped by 30. We are waiting for another update from the city on these numbers. We'll have it for you in just about an hour or so.
And turning to testing now, I want to get you the latest numbers from the county. First, more than 166,000 people total have been tested now. 87% or so negative, a little more than 12%, the rest of those positive for the virus. We know a lot of you at home are wondering what's next if you do get tested. Well, they say while you are waiting for test results, assume that you're positive, act like it, stay at home in a room away from others, wash your mask daily, and also identify close contacts, anybody that you spent 15 minutes or more with, going back at least a couple of days before you started showing symptoms.
And if you find out you are positive, expect a call from Metro Health. They will start the case and investigate your case. They say it's very important that you answer that call so that they can work to help contain the virus. Call your close contacts and let them know that you do have the virus. And of course, stay home and stay away from other people.
Now, if you have been diagnosed with COVID, so how do you know when you're okay, well enough to be around people or not infectious? Well, Metro Health says a person is considered fully recovered if 10 days have passed after the symptoms have appeared and if there hasn't been a fever for 3 days without you taking any medicine.
We are 1 hour away or so from getting an update from the city on COVID-19 here in San Antonio. We will, of course, be carrying that briefing live right here on News 4 as well as online at news4sa.com.
Melissa Vega at the live desk. We are following some breaking news. World Car Sky 4 over a massive brush fire. This is on FM 78 in Schertz. We are working to get you some more information. And just in, the San Antonio water system announcing stage 1 water restrictions beginning tomorrow for the first time since 2018. So here's what this means for you. Tomorrow, you will only be allowed to water once a week, your sprinklers, irrigation systems. Your watering day will be based on the last digit of your address. For example, 6 and 7 is Thursday. You can only water before 11 a.m. or 7 p.m. There's no watering on Saturday or Sunday. However, hand watering is allowed any day, anytime. The director of the Conservation Department for SAWS telling me just a short time ago that we've been lucky for 2 years, but recently things have been brutal and they're hoping we start getting some rain. Randy?
All right, thanks, Melissa. A scathing new report shows that Texas still has a lot of work to do when it comes to child welfare. It's a 10-month investigation that revealed, quote, a disjointed and dangerous child protection system where harm to children is at critical times overlooked, ignored, or forgotten. Well, News 4 troubleshooter Emily Bauckham reports, I understand, Emily, the person in charge of the system refused to sit down for an interview with you.
And Randy, we certainly hoped for that interview to hold leaders accountable because this report raises so many red flags, like how many calls to the abuse hotline go unanswered and just how long it took to discover a teenage girl committed suicide inside an emergency shelter.
It's very disheartening.
More than 300 pages, the work of federal court monitors who went inside the child welfare system.
And it's bringing light deficiencies that I don't think, as a lawmaker, I would know about.
State Representative Ina Minjares says the most disturbing finding, far too many homes, shelters, and centers where children are placed are not living up to their promises.
I can't have children continue to be placed in these placements and possibly be in danger.
3 deaths this year are highlighted. In February, a 14-year-old girl collapsed and died inside a residential treatment center. Staff waited 37 minutes to call 911 because they thought they needed permission. In April, a 3-year-old boy died after being found unconscious with blood coming out of his ear. The report details how hotline calls sparked 2 abuse investigations into his foster caregivers, but CPS workers did not remove the boy from the home. Later in April, a 15-year-old girl hanged herself in the bathroom of an emergency shelter. Because of her mental health history, she was supposed to be monitored at all times, but security video showed it took staff 30 minutes to find her.
There's no accountability. And so it's unconscionable to have children in care die.
The report also found thousands of calls to the state's abuse hotline go unanswered.
Is that acceptable?
Not acceptable at all. So we got to figure out what's going on here. Is there a lack of people that are available in the position to answer these calls? Ignoring possible reports of neglect and abuse is just unacceptable.
The troubleshooters wanted to find out how Jamie Masters, the new commissioner of the Texas Department of Family and Protective Services, plans to use this report and make the system better. We were told she wouldn't answer our questions.
We are fully responsible if something happens to a child in our care. This is a situation that we can't be silent on. This needs to be a priority.
The governor and 2 state agencies have now filed a court objection to this report. They claim that it only discussed deficiencies. It didn't address improvements like hiring more staff and changing policies. In a statement today, DFPS told us it would share more details with the court soon. I'm News 4 troubleshooter Emily Balcom.
All right, Emily, thank you. Just ahead tonight, the Supreme Court rules on President Trump's tax returns. Their decision on his financial affairs being made public.
Plus, the push to return students to the classroom will tell you details of the plan unveiled for the country's largest school district.
Well, a lot is happening in San Antonio and across the state when it comes to COVID-19. Hospitals in different cities are running out of beds. The Freeman Expo halls are on standby to help patients. San Antonio has stopped testing non-symptomatic people at their public testing sites, and the TEA has released guidance on heading back to school. There's a lot to talk about. Joining us now is Governor Greg Abbott. Thank you, Governor, for joining us today. Right off the bat, let's talk about teachers. Up to now, parents have had the choice what to do with their kids. Do they stay at home to learn or do they go back to school? But we've heard from a lot of teachers who say, nobody's asked us. How do we feel? Can we stay home? Should we go back? And what happens if they refuse to go back to school? Could they be fired? Talk to your constituents tonight, the teachers out there who are worried about their health and also the future of their job.
Well, actually, the message is the same to both the students, the teachers, as well as to the parents and the entire staff, and that is that we're putting health and safety first and foremost. And so a system is being constructed to make sure that the health of teachers as well as the health of students and the health of parents would be held in the highest regard, as well as flexibility. We know the importance of not losing a generation of students because of a pandemic. We know that the desire for teachers to be able to educate students and their innovation, their ability to use these new and different methodologies as may be needed for a few more months as we move toward a time period when we will have immunizations to be able to treat COVID and get everybody back into a classroom as normal. Before then, however, we need everybody to work together so that we do not lose these kids by using the distancing tools that we have to make sure we can educate children in a very safe environment.
But for those teachers who may be afraid for their health, maybe their health is vulnerable to this virus, maybe they live with someone else who is, and they simply refuse to go back to work legally, could they lose their job?
Well, those are issues they will need to be talking to their school district about. And so that will be between them and their school district. That said, I know that standards are in place to make sure that the health and safety of these teachers will be put first and foremost.
Yesterday, we had 10,000 new cases, almost 10,000 new cases across the state of Texas. Do you have any plans in place if those numbers just continue to rage on and spiral out of control? Would you scale back going back to school at all, or is that a hard no?
Well, listen, it's essential that we continue to respond to data. First, real quick, the data, and that is you point out the people testing positive, but of course, more ominous than that are the people who are in hospital beds, as well as the number of deaths. The main thing we need to do right now, Delaine, is to make sure that the entire public comprehends the magnitude of the problem that we have on our hands, and that is this is a very serious disease. The reason why I point that out is because if everyone understands the magnitude of the problem and they respond accordingly by adopting this policy of everyone wearing a face mask, if they do that, we can go back to school, we can go back to work, we will not have to close anything down, but we do need everybody to adopt these best safe practices.
If you had children, would you send them to school? If you had school-aged kids, would you feel comfortable sending them into the classroom right now?
So I do have a daughter. She did just graduate from college. But yes, I would feel appropriate for her to go back in. Understand this, however, Delaine, and that is every parent has a choice to make before the school year begins, and they can make it during the course of the school year, whether or not they want their child in the classroom or learning from home. I feel comfortable as a parent myself about being able to make that choice for my daughter about if there is a serious outbreak, I can decide to keep her at home and have her learn from home through these distance learning strategies. But every parent has the right and the ability to make that decision.
Governor, thank you so much for your time as always. We appreciate it. Chris, over to you.
Now your certified most accurate four-zone weather with Chief Meteorologist Chris Suchan.
All right, well, we head outside and it is hot and humid across our four zones. Our World Car Weather Cam view showing us really nothing more than little shade, fair weather clouds. Temperatures across our four zones, 99 so far in San Antonio. We'll see if that ticks up to 100. Or right now it's 100 New Braunfels, 105 out west in Del Rio, where it's also feels like it's 113 in Del Rio right now when you factor in the humidity. So again, these temperatures here only going to be getting hotter, as you'll see here in just a second. Of course, no rain in the forecast here. Really, most of the state's dry. We have this big ridge to our west. That's the dominant weather player for us over the next 7 days. That is our next weather maker that's already here. But I'm going to show you here in just a second how it really manipulates our temperatures over the next 7 days. By the way, the drought update came out today. This is the way it looked 3 weeks ago. So let me roll on this, and you can see now how with our dry conditions in the heat, we're starting to see dry conditions spread across the area. Of course, we have moderate to severe drought now out to the west. This will continue to expand across the area now with the pattern that we're in. So let's watch this ridge. It gets stronger. It is ideally positioned into Sunday to really ratchet up the heat. I am now forecasting the hottest temperature we've seen for the month of July in San Antonio. I'm going 107 Sunday. It's sitting over us Monday into Tuesday, still blow-torching with the temperatures. And then later next week, it shifts to the northeast. So now we're getting into maybe a little less on the daily air temperature where it's 90s to around 100. But now we're also getting into a little higher humidity coming into the south side of that ridge. So here's our temperature trend. 101 tomorrow, 103 Saturday, 107 Sunday in San Antonio, and 106 Monday. And again, the records will be falling. 106 the hottest for the month, 107 Sunday. We'll tie that mark on Monday, and then 105 Tuesday. So lots of breaks, hydration, sunscreen. Don't forget about young kids and pets and cars. Don't leave them in there in this weather. And of course, check on those without air conditioning. And of course, walking your dog too. Make sure you're walking them on concrete or grass. Avoid the blacktop, as it is an absolute scorcher on their little paws. So here's our four-zone weather. Out west tomorrow, 101 to about 106. Goes without saying, across all four zones, we're not forecasting rain chances. 90s to around 100 in our eastern zone, and 101 San Antonio to 106 into Cotulla. 101, 103, 107, those red boxes are all daily record high temperatures. 4 straight in San Antonio. Next week, we'll get it down to around about 100 on Thursday. Out west, 106 to 111, 112 Monday. Hill Country, 97 tomorrow, over 100 for your upcoming weekend. And here's a look at your eastern zone extended forecast. Now here's Don.
Hey, we are starting to see those images come out of the Orlando bubble in the NBA. The players in lockdown. We'll hear from the Spurs on what they expect next.